This program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest UCTV programs. Also, make sure to check out and subscribe to our YouTube original channel, UCTV Prime, available only on YouTube.
Good evening, everyone. I'm going to get us started. Welcome to the final installment of Mini Med School in Pediatrics. I see some familiar faces from the last two sessions. I guess you guys have enjoyed it. We certainly saved the best for last. Andy, my friend Andy, Dr. Andy Marmer, who's an associate professor in the Department of Pediatrics, and has been one of my favorite teachers over the years, and I'm proud to call her a colleague. I could list off her teaching accolades, but most recently, the Pediatric Residency Program awarded her the Resident Teaching Award, which was not the first time and won't be the last time she receives this award. So as I say, you're in for a treat. The talk this evening is Fever, Friend or Foe. So over the last 6 weeks, we've been trying to explore some controversial topics in pediatrics that may have some benefits, may not have some benefits. Certainly, you know, there are those who say fever, great, sweat it out, and there are those who say fever, oh my God, my child has brain damage. And there's everything in the middle. And I think we're all looking forward to hearing Andy explore that with us. So I'll turn the mic over to Dr. Marmer.
Thank you. Oh, thank you very much. I haven't even said anything. Look at that, so nice. Well, welcome. I'm really delighted to see this hardcore group of people here to talk about this, this topic that's very near and dear to my heart, and I think this is something that everybody has experienced at some point in their lifetime, whether for themselves or their child. We'll start off with a little Elvis to get us warmed up. All right. Nice. Everyone's in the groove. I have nothing to disclose. So, as Elvis says, we're going to be talking about fever, and the title of this is Friend or Foe. And it sounds like, in talking to some of the other speakers that have been speaking in this series, that this topic has come up before. And as Glenn alluded to, I think with a lot of symptoms and issues in pediatrics and in health in general, as we start to understand more and more about the purpose of some of these symptoms, it becomes a little bit less clear whether to treat them or whether to simply sort of let them run their course. And I think fever is one of the things that most classically illustrates that issue in medicine. So these are the four topics that I'm going to address today. We'll start out really with just defining what is a fever. And you may think you know what it is, but I'm going to distinguish fever from a couple of other things that may seem like fever but be a little bit different. And we're going to actually talk about what happens when your body experiences a fever. What is it that produces fever in the body? Because that is directly relevant to our understanding of how to manage it and why to manage it. The second topic will be fever phobia, and this is a term that came into use in the 1980s. I'll tell you a little bit about the history of the term and where it comes from, and a little bit about maybe why we are so afraid of fever, especially nowadays. Is there a purpose to fever? And this, I think, is probably something that's very interesting to you and to me as well. You know, clearly there is, at some point, was some purpose to fever, and the question really becomes now in the modern era of antibiotics and other things that we can do to treat infection, is there still a purpose to fever? And more importantly, is it harmful to treat fever? Are we taking away something from the body by treating fever? And then finally, we'll get very practical here with what you can do when your child or friend has a fever, what to do about it. So those will be the four topics for today. So let's start out with just defining fever itself. I think everyone can probably define it as an elevation above normal body temperature. But what does this actually mean? So Normal body temperature, where your body is comfortable and likes to keep itself, is really defined by this thermostat. We call it a thermostat. Obviously, there's no actual thermostat in there, but a bunch of cells that like to be at a particular temperature. And that is in the hypothalamus, part of the brain. And what is defined in the literature as normal body temperature is somewhere between 97 and 100 degrees Fahrenheit, or we often kind of round that off to 98.6, and everyone knows that's the normal temperature you should see on the thermometer if you take your temperature and you don't have a fever. But what actually maintains normal temperature is quite interesting. So constantly, even as we're sitting here in this room, we're all doing things, both voluntary and involuntary things, to keep our body at a normal temperature. If it feels cold to you, you're probably going to put on a scarf and bundle up a little bit. If it feels hot, you might take off your jacket and cool off. Your skin, your heart, all of these things are doing something to help to maintain where your hypothalamic set point is, or your thermostat wants to be. So an elevated body temperature can occur as a result of two major things. One is that the thermostat can change. The set point of the thermostat can change, and that results in a fever. But there is something else that we're not going to talk about today, but I think it's important to know, which is hyperthermia. And hyperthermia, while it means high temperature, is defined as an elevated body temperature that is the result of either external heat, such as heat stroke, something like that, or a failure of the body's cooling mechanism. So if you have a disorder where you can't sweat, you can then develop hyperthermia if you exercise, something like that, right? So we're not going to address that type of overheating. We're really going to address the type of overheating that occurs via a change in the hypothalamic set point, which is known as a fever. All right, so slightly blurry picture here, but where does fever come from? So what changes the thermostat in the hypothalamus and causes us to get a fever? So let's look back at kind of the initial event. Typically, we associate fever with infection, but really anything that stimulates the immune system, and certain cells specifically in the immune system, can cause a fever. And in this particular cartoon, you see a macrophage, which is a cell in the immune system that eats bacteria, eating a bacteria. But as we know, viruses are probably far more common causes of fever than bacteria, so those can also stimulate the immune system. And the endpoint of this activation of the immune system is the production of something called interleukin-1, which is a cytokine. Cytokines are little hormones that fly around in the body and tell other cells what to do. And this particular one is very important in the development of fever. So once the immune system has been stimulated, interleukin-1 is produced, it then travels up towards the brain and it stimulates the hypothalamus and causes it to change the set point. And the way that the hypothalamus changes the set point is what the release of prostaglandins, which are other little chemicals in the blood that have a lot to do with inflammatory response. And by inflammation, I can be referring to either infection or something like an inflammatory disorder, like rheumatoid arthritis or lupus. Those are inflammatory disorders. So the hypothalamus itself produces the prostaglandin. That changes the set point of the hypothalamus. Then how do you get a fever? So we've now changed the set point. We haven't done anything to change the temperature of the person. So the thing that happens next is the hypothalamus then signals the body to heat itself up. And that's how you get a fever. So there's nothing about the infection or the immune system's response that has caused the body temperature elevate. All of that is going to be done by the body in order to match the new set point. So why do you feel cold when you have a fever? And this is really the core of the experience that both children and adults have when they have a fever. Why do you feel cold when you have a fever? Because your body is trying to match the new set point. So the same reason if you felt cold in here, what would you do? You'd put on your jacket. You might move around a little bit. You might shiver. All of those same things are things that both adults and kids do when their set point has been changed to elevate their body temperature. And we can divide them into two categories. There's involuntary mechanisms, which means things that you're not doing on purpose, and then voluntary mechanisms as well. So some of the involuntary things that happen, shivering, which is a great way to use your muscles. It's basically like exercising, so you're increasing the heat in your body. increased metabolic rate. And for a young child, we typically see heart rates in the 180 to 200 range in a young child with a high fever. So this is a very powerful mechanism by which a young child can elevate their body temperature. And then centralizing blood flow. And this is also incredibly important in children. And what that means is that your body shuts down all of the peripheral capillaries in your skin and tries to shunt them centrally so that your core body temperature rises. Because your hypothalamus is measuring your core body temperature. It doesn't care what the temperature of your fingers and your toes are. It wants that core body temperature to go up. So all your blood goes centrally, your hands and your feet get sort of cold, they get pale, they might even get a little bit bluish, and that's a very effective way of heating up the body. Voluntary things, what do? Seek warmth, put on clothes, and here, of course, is a child who's all bundled up as any febrile child would probably wish they could be when they had a fever because they feel cold. But we're talking about kids here, and as you look at this list, you can see that there's several of these things that probably would be very difficult for, say, a newborn infant to do, right? They can't go crawl to a warm spot, they can't pull the blanket around themselves or cover up their head or their hands and their feet. So they depend on us to do that. So what are the behaviors then that a child can do to raise their body temperature? And this is where things get very interesting for a pediatrician. So this picture illustrates a couple of things that I look for when I'm seeing a child who has a fever. The first picture is a newborn baby. And has anyone ever seen in a newborn baby how their hands and feet and sometimes even their lips look a little bit bluish? Anyone see that? That's a completely normal reaction to cold in a newborn. And it's basically the same thing we just talked about with the centralizing of blood flow. So they're shutting down blood flow to their hands and feet and centralizing blood flow. So most parents who come to me with a child with a fever will just say, I was really worried because I felt his forehead and he was burning up, but his hands and his feet were freezing. That's a very common complaint or description that a parent will give when their child has a fever, and it's all because of this normal mechanism of trying to increase body temperature. The other thing that children often do when they have a fever is they want to be held. They just want to cling to their parent, they want to be wrapped up in a blanket and kept warm. And that helps to elevate their body temperature. They're trying to match that set point. And that's their way of doing that. And body heat is the most effective source of heat for a young child. They have not very good ways of keeping in their heat otherwise. So these are some adaptive mechanisms that children have that help to increase their body temperature when they have a fever. All right, so the next question you might have then is, well, then how do we treat a fever? So we're going to get to whether or not you should treat a fever. But if you did want to bring down the temperature, what are the things that you could do? And one of the common things that we do in the modern era is we give medications that treat fever. And what do those do? So antipyretics, which is the medical term for medications that treat fever, what they do is they actually reset the set point. And most of them act at that prostaglandin level in the hypothalamus, so they're interrupting the hypothalamus's ability to change the set point, and it then goes back to a normal body temperature set point. But then how does the temperature actually come down? Well, the opposite of all those things that the human being did to try to heat themselves up then have to occur for them to cool themselves down. So what happens to a child when you give them some medication for their fever? They get sweaty, they get hot, they get flushed, they want to take off all their clothes, they don't want to be touched anymore, they push you away, and those are all things they're doing to try to cool down their body. So the same list, involuntary and voluntary lists, behaviors that people will do to try to cool themselves down. So the reason this is important from a practical standpoint is people often wonder why, when people have a fever, why don't we put them in a cold bath or sponge them down with tepid water or wipe them with alcohol? And these are all behaviors that a lot of people do or may have been taught from family members are good things to do when you have a fever. Physical cooling measures are extremely ineffective at bringing down body temperature. What they do instead is they make a child very angry, very uncomfortable, and very cold. Already they feel cold and they want to be warm. So when you put them in an ice bath or you take off their clothes and you try to fan them, they're going to be really, really angry. And what happens when a kid gets angry? They get hotter. So it's very ineffective at bringing down the temperature. Antipyretics work very well for bringing down the temperature. You reset the thermostat, the child then cools off, their body gets flushed, they sweat, they take off their clothes, and they're able to cool down very effectively. And to go back to that initial definition slide that we had about hyperthermia, these measures are very effective in hyperthermia because there's no difference in the set point. The person is just too hot and you've got to cool them down. So that's an important difference to keep in mind. All right, so thankfully we have now 1,000,001 different ways of measuring children's temperatures, and here are just some examples. We can measure it in the mouth. There's these handy dandy little strips you can stick on the forehead. You can stick the thermometer under the arm. You can stick it in their ear. There are all different places to do it. You've already learned that really what we're interested in here is the core temperature, right? So right away you know that the most accurate methods are going to be ones that go into some sort of orifice, whether it's the ear or the mouth, or nobody likes to do it, the rectal temperature is probably the most accurate. But any kind of temperature that's on the surface of the skin is going to be a little bit lower than what the core temperature is. And so as a pediatrician, if a parent says to me, I took the temperature under the arm and it was 100.4, in my mind, I tend to add a degree to that to think about what is the actual core temperature of the child. So that's something else that we think about a lot. All right, very common question that I get from my students and residents in training in pediatrics, and also from parents, which is how good are parents at detecting fever? And the answer is they are much better at ruling out fever than ruling it in. So here, of course, is a young turkey who tried to fake a fever with his mama by putting some hot towels on his face, and she, of course, realized it was not a real fever. But parents, when touching foreheads, are much, much better at saying my child doesn't have a fever than saying that they do. On the other hand, the general teaching in pediatrics is that if the parent reports a fever, you believe it. So if your child has a fever, they're very uncomfortable, you treat them and you bring them into the hospital and they no longer had a fever, in general you should expect the provider to believe you that they did have a fever at the time, and that's the general teaching. But the fact is, if you actually study it, that parents tend to think sometimes kids have fevers when they don't, but if they say they don't have a fever, we know for sure that they didn't. So what is fever to a pediatrician? So in pediatrics, we are very interested in the actual number. And so we always think about actually taking the temperature with a thermometer, and the most accurate temperature is a rectal temperature. We routinely do that. If you bring a child into the clinic, we'll routinely do a rectal temperature in kids that are less than 6 months of age. And after that, typically our nurses will check the temperature with one of those tympanic ones or with an oral thermometer or something like that, just because it's less uncomfortable for the child. But the reason is that we get very worried about even very low-grade fevers in very young children, and it's very important to be extremely accurate about that temperature. So in young infants, and neonate is defined as an infant less than 1 month of age, we call a temperature above 38 degrees centigrade or 100.4 Fahrenheit. Whereas in older kids, we typically define a fever as a little bit higher than that. So that actual number is important, and is why I recommend to parents typically to actually take the temperature with a thermometer, because that number can be helpful to us if we're talking to you on the phone or helping give you advice about your kid. There's a lot of information behind that. What does it mean to me when a child has a fever? Typically, it means infection. In general, we know that fevers are caused by infections, and they're also caused by non-infectious things. You know, cancer can cause a fever. We talked about rheumatologic conditions. There's a lot of things that can cause fevers. In kids, by and away, the largest cause of fever is infection. So I'm primarily concerned about infection when a parent says that their child has a fever. Fever often makes a child uncomfortable. Everyone knows that. Kids that have a fever, they have chills, they're just achy, they can't get comfortable, they want to be held, they don't want to eat or drink, they don't sleep well. It makes the child uncomfortable, and that's important to me as a pediatrician as well. It also usually makes the parent uncomfortable. And so this brings us to our next topic, which is fever phobia. So where did this come from, and what is it? And this is a leaflet, AAP News, American Academy of Pediatrics is a leaflet that comes around to my house every so often, and on the cover of it a few months ago was fighting fever phobia. So this is a term that we throw around in pediatrics and think about a lot. So let's look back and figure out where it came from. So the term was actually coined by this guy, Barton Schmidt, who is well known in the pediatric circles for this book on pediatric telephone protocols. So if you ever wonder how the triage nurses know what to do with your phone call, it's usually all based on Barton Schmidt's work. And he is a pediatrician, and he wrote this article in 1980 where he interviewed a bunch of parents about their beliefs and knowledge about fever. And what he found was that all of the parents he interviewed described themselves as concerned about what we tend to call a low-grade fever, which is a fever less than 102. They all said they were concerned about that level of fever. over 50% believed that fever itself could cause neurologic problems. And the vast majority of them treated fevers that were low grade. So this was in 1980. And we'll bring that up to date and kind of look at has that changed in the modern world. But let's take a look way, way, way back and think a little bit about the evolution of the concept of fever and why it might cause so much fear in people's minds. So if we go way back to ancient medicine, fever, while it couldn't be measured, was certainly well described and well known and was a very, very common symptom. And Hippocrates' time, his belief was that illnesses tended to be caused by an imbalance of one of the four bodily humors, which are represented up there. And you can see that they are described in different properties. So you've got the hot, the dry, the wet, and the cold humors. And when things were unbalanced, the fever, Hippocrates believed, actually cooked off the excess humor. So he was very clear that fever itself was an adaptive mechanism that was beneficial. In Ephesus, another ancient physician from the 2nd century AD reportedly said the following: if there were a physician skillful enough to produce a fever, it would be useless to seek any other remedy against disease. So clearly these physicians thought of fever as a very useful and adaptive response that did not cause any damage to the individual and didn't need to be treated per se. They did, treat the discomfort, and what they tended to do was treat fevers with starvation and cool drinks. And this was designed to reduce the bile and blood, which were the hot humors that presumably were in excess here. Another area of medicine, so traditional Chinese medicine, also been around forever and practiced today as well. Very complicated, and I don't claim to be an authority whatsoever in this area. But with a similar structure of different elements that are involved and that need to be balanced in the healthy body. And according to traditional Chinese medicine, there are multiple different causes of fever, each of which needs to be treated differently. And one interesting theory that I read was that fever is actually caused by excess chill or cold, and you actually treat it with warmth. And if you think about it, that makes a lot of sense. So the organism is trying to get their body up to a higher temperature. That's what the set point is telling them to do. They feel chilled. What they really want to do is be warm. And so that's how fever is treated when it is caused by chill or cold. Can also be caused by qi or yin deficiency. And then the imbalance must be corrected, but fever itself is rarely thought of as a specific dangerous entity or cause any harm to the organism. All right, so evolution then of the idea of fever. So we started from kind of this place where fever was actually a good thing. Then we hit this area of our history where febrile illnesses really did a lot of damage. There was the Black Death, the plague, tuberculosis, all kinds of diseases that people really didn't understand. And the only thing they knew about them was that these people had fevers and then they died. And so fever really became synonymous with death. In many cases in history as well, fever was synonymous with demonic possession and other bad things. So fever really became a very, very fearful, scary syndrome around this time in our history. And an important difference between the way fever was viewed at this period than way back in Hippocrates' time is that fever itself was thought to be the illness. Fever was the thing that caused the person to die. And there wasn't really a concept of disease. There certainly wasn't a concept of infection or anything like that that was causing the fever. And the theory behind it had, again, something to do with the humors. So it was caused by an excessive blood or bile and became very, very popular to do bloodletting as a treatment for this. And so here are some images from historical documents showing bloodlettings. I wanted to throw in a couple of things from literature and art because I think fever is something that has captured the minds of many of our creative people in our history. So I always remember when I was a medical student and I first learned about scarlet fever, my first thought was, oh my gosh, that's what killed Beth in Little Women. And that's what made Mary in Little House on the Prairie blind. So in these books, these febrile illnesses were often called one thing or the other, scarlet fever. Who knows what they really were? These people might have had measles, they might have had meningitis, who really knows? But regardless, their illness and their death was attributed to scarlet fever. And I think what this really illustrates is that these things were scary and there was nothing they could do about them. Penicillin, which cures scarlet fever, wasn't invented until 1928. So still, even at this relatively late period in our history, there really wasn't a lot that people could do about infections, and febrile illnesses were very scary, and they really did hurt people. This is a painting by Edvard Munch, the Norwegian painter who is known for his psychologically disturbing and interesting paintings. And this particular one is called By the Deathbed or Fever in 1893. And it's a painting of his sister who died of tuberculosis. Both his mother and sister died of TB. And in this period of time, TB was really rampant and again was terrifying to people because there wasn't anything really aside from a terrible fever and a long illness at the end of which people died, and there wasn't anything they could really do about it. They didn't understand what infection was. They didn't know what these fevers were being caused by. So it's not all that surprising that at this point, people were very, very afraid of fever. So let's move a little bit forward. So we did eventually discover infection, and that happened later. So pre the 18 and 1900s, illness was really thought to be something that was an imbalance within the individual. So it had to do with their humors and the balance of different things within their body. And there wasn't really a concept that illness could be spread from one person to another, or that there might be an external thing causing it that was common to different people with the same illness. And this discovery was made by Dr. Semmelweis, who's a Hungarian physician. And he was working in a hospital where there was a large ward of women who had just had infants. And there was an extremely high rate of what was called childbed fever at the time, which was a febrile illness that occurred after childbirth that was killing enormous numbers of women. And he just became horrified by this. And he very carefully charted the cases of these women and very carefully observed them. And he concluded that their symptoms, which in many cases included fever, could be led back to a common cause, which he deduced was actually cleanliness. And he was one of the first people to recognize that their illnesses might in fact be related to the fact that the physicians that were examining these women after childbirth were carrying around on their hands some sort of germ, he called it like a little body, something on their hands that was then infecting these women. And he was one of the first people really to recognize that the fever itself, while a common symptom, was due to some sort of common cause, as opposed to being the disease itself. So he introduced hand washing in this maternity ward and dropped the mortality rate from about 30% among postpartum women down to 1%. So remarkable. And of course, many, many people after him, including Lister, after which Listerine is named, then popularized the process of actually washing your hands before doing surgery on somebody. But it was another 20 years before Louis Pasteur actually popularized the germ theory and recognized that you could actually find those little microbes that were passing among people and causing disease. All right, so that brings us up then to the 20th century. So a lot of people in the early 20th century started to really study infectious diseases and also really began to study anatomy very carefully, and they were able to really document that that fever was really a symptom of a bunch of different kinds of disorders, that there was an etiology to the disorder, it affected certain organs, and that fever was the body's response to it as opposed to being the illness itself. And treatment of fever then became something that people were interested in doing. So we mentioned several of the other treatments, bloodletting. Well, thankfully, somebody invented aspirin in 1899 and chewable aspirin shortly afterwards. And I love this ad because here you can buy aspirin or heroin, which is very effective for cough. Both of them worked very well, but had other issues. So interestingly, aspirin was invented far before people knew about the hypothalamus and what was actually going on up there, and it wasn't until the 1970s that the actual prostaglandin pathway and inflammatory pathway became known, and then people developed a lot of other medications that we now use instead of aspirin to help to sort of break that cycle and bring down fever. All right, so that brings us up to today. So there we are. So now, why are so many people still afraid of fever? So in 2001, another pediatrician decided to revisit the fever phobia article that Dr. Barton Schmidt had written and find out, have we gotten anywhere in terms of informing people and educating them about fever? And he found that still 91% of people believe that the fever itself, even a low-grade fever, could actually harm their child. And this is a table from his paper that showed, interestingly, that So he compared the results from Dr. Schmidt's paper, which are here in the first column. So these are the results from Dr. Schmidt's paper, where people were asked to choose what did they think was their primary thing they were afraid of as a result of fever, and most of them chose brain damage. Interestingly, in the repeat study in 2001, 20 years later, most people thought that seizures were an important risk of fevers. But as you see, the number of people overall that thought fevers could be very harmful hadn't really changed in 20 years, which is very interesting and surprising to the authors. So I did want to talk a little bit. How many of you, before this talk, how many of you would have thought that fevers cause seizures? Anyone? One person? A couple of people? Good. Extremely high fevers. Okay, great. So this, I think, is one of the most common things that people are concerned about with fever. So I want to clarify a couple of things. So the term febrile seizure is actually a diagnosis, and it is not caused by fever at all. We used to think it was. So there's something called febrile seizures, which is something that occurs only in children. It occurs in kids from 6 months to 6 years of age, and it happens primarily in children who have a family history of febrile seizures. Not a history of a seizure disorder, epilepsy, or something like that, but a history of febrile seizures. And the current understanding of this disorder is that it has nothing to do with body temperature at all. That it's related instead to an immune response, usually to a viral infection, and the picture of the little girl here has roseola, which is one of the most common viruses that is associated with febrile seizures. And these children, at the onset of a febrile illness, will have a brief seizure that doesn't recur, that goes away on its own, that doesn't require any treatment. Some of them will have recurrent ones. They'll have another one before they outgrow it, but most of them don't. And these seizures are not associated with epilepsy. They don't need to be treated, and they don't cause any sort of long-term damage in the child at all. So that's this concept of febrile seizures. The medical profession had previously associated this with the fever itself, but we now know it has nothing to do with the fever. It's completely related to the immune response to the infection in certain vulnerable individuals. And we know this because you can't prevent it by treating a fever. So many parents whose children had febrile seizures as children would treat them around the clock with medicine to prevent them from getting a fever, and they would still have a seizure. So it has nothing to do with body temperature. It has everything to do with the cytokines that are released as a result of the infection. But the concept of maybe if a fever gets high enough, could it cause a seizure? So that's a great point. Fever itself, and remember the distinction between fever and hyperthermia, and this is where this is very important. Fever caused by an infection and caused by an abnormal set point in the brain really rarely gets above 105 degrees and cannot cause a seizure. You are correct that if your body temperature gets high enough, yes, it will cause a seizure, but that is never caused by fever. That is caused by hyperthermia. So we see those types of things in patients who have brain damage, for example, and can't control their body temperature, or somebody who has heat stroke and is exposed to excessive heat and can't cool themselves down. Their body temperature can go above 106, and yes, that can cause a seizure, but fever itself does not. Another confusing factor is, of course, febrile illnesses can cause seizures. So if you have meningitis or encephalitis, and that's why you have a fever, that absolutely can cause a seizure. But fever itself cannot cause a seizure. All right, so another study that's interesting, and I'm going to show you two studies that were done around the same period of time in pediatric emergency rooms. And these two investigators were particularly interested in the characteristics of parents that might make them more or less concerned about fever. And so they grouped parents by ethnicity in this particular study. And the one I'm going to show you in a minute, they were looking at parents based on educational level. And in this case, they were looking at Caucasian, African American, and Latino parents and asked them, would you describe yourselves as very worried about fever, or do you believe that fever can cause death or brain damage, which, again, it cannot. And while I think the differences in ethnicities are interesting, I don't really know what to do about that. To me, what's most interesting about this is that really the majority of parents, regardless of their ethnicity, had beliefs about fever that were not true. Which I think is very interesting. And this was done in 2010. This was the other study I was telling you about. And in this one, they compared parents who had different levels of education as far as how concerned they were about fever. And this particular graph shows that the temperature at which they would take their child to the physician or call their physician goes up with level of education. So what it seems to imply is that people with higher levels of education tend to be a little bit less concerned about lower fevers. That's basically what they found. What about the rest of the world? Is this something that's unique to the US? Is this something that we see in other places? I found a couple of studies addressing this question that I'll highlight for you. One in Japan, where they basically found that parental concern was about the same as the studies I showed you that have occurred in the US. Interestingly, they found that in Japan, parents were far more likely to use their medical provider as a source for information about fever than in the US, where apparently only 7% of people thought their medical provider was a good source of information about fever, which is very interesting. And I found this one study from Saudi Arabia where they actually interviewed 600 physicians. So this is not parents, these are physicians. And among this group of physicians, 95% of them thought that fever itself was dangerous, could cause either brain damage, seizures, or death, which we've established is not true. And almost all of them would recommend sponging or bathing for fever, which, as we talked about, is a very ineffective way to bring down body temperature if in fact you want to do that. So this kind of misinformation and mythology that people have about fevers is very, very common. And we'll talk a little bit about whether there's any reason to be afraid of actually treating fevers in the next section of the talk. So is fever actually beneficial? So we've established it's not really harmful and we don't need to be afraid of it. But let's look at the question of whether it's actually helpful. And this is a quote from Thomas Sydenham, who's another very interesting historical physician. He was known as the father of observation and diagnosis. And he apparently said that fever is nature's engine, which she brings into the field to remove her enemy. So again, someone who really thought of fever as a very useful adaptation for the body that could effectively fight infection. So possible benefits of fever. How could fever be beneficial? Well, one way that it could be beneficial to the individual who has an infection and has mounted a fever is that it could potentially increase their immune process or impair the growth of bacteria. It could also cause behaviors that are therapeutic. So we all know that when a kid is sick, what do? They don't go out and play, they don't go out in the snow, they sort of lie around and they rest and they take care of themselves, and as adults we do that too. So it may have multiple benefits to the individual. It's interesting also to think about the sort of evolutionary benefits it might have to society. It's a very, very powerful signal that someone's sick. And we know now, of course, that you try not to be around sick people because that spreads disease. So maybe fever, because it signaled to other people that this person was sick and it kept people inside and away from others, could be evolutionarily adaptations. But are any of these things relevant today? So now we have very powerful and very effective ways of treating infections. And viral infections are harmless anyway, and they're going to go away, so we don't need to worry about those. So does fever have a purpose now in this day and age? And more importantly, even if it does have a purpose, does treating a fever and making your child feel better actually harm them? Does it actually impair their ability to fight off an infection? So those are two important questions, and we'll look at the evidence on that. Is it actually true that temperature increases immunity? And it actually is in what's called in vitro. And in vitro means when people study models of disease outside of the person. So people that have studied bacteria in dishes or little tubes have found that bacteria really like to grow at normal body temperature, which is about 35 to 37 degrees Celsius. We talked about the Fahrenheit. And bacterial growth is impaired at temperatures that are above 38, which is typically what we see with a fever. So again, that's in vitro, but there is a suggestion that this is in fact more than a theory, and that in fact bacterial growth is impaired by higher temperatures. And so maybe fever is part of the body's attempt to slow down the growth of bacteria and get rid of it. We also have some evidence about the question of the immune function. So a lot of it comes from animal models, which I always think are kind of interesting and fun. Two main animal models have been used for the study of fever. One is lizards, and lizards are particularly interesting because they are, of course, cold-blooded. So how does a lizard get a fever? You put it in the sun. So what lizards do, if you infect them with bacteria, is they crawl to a warm rock and they heat up their body. So they are doing the same thing that we are doing when we sit in our house with our blanket and we shiver, but they're doing it by going into the sun. So people have done a lot of interesting work on lizards because it's kind of, you can control it. You can prevent them from going to the warm rock and you prevent them from getting a fever. And so what they have found in lizard models that are infected with various bacteria that are bothersome to lizards is that when they are allowed to go to a warm environment or when they are placed in a warm environment, their survival rate is higher. And if you prevent them from getting a fever, if you prevent them from moving to a warm environment, or you give a medication that suppresses their ability to increase their body temperature, that they have increased mortality from, again, bacterial infections. And this is important because we keep in mind that many fevers are caused by viruses, not bacteria. So that's lizards. So what about rats? Same thing seems to be true in rats, and in rats as well. If you either induce a fever or allow the rat to become febrile, allow their normal mechanisms to occur, those rats do better than ones that you either prevent or treat the fever in. And in addition, looking at a cellular level at the immune function of the rat, people have observed that those that are allowed to become febrile have increased numbers of immune cells and better function of those cells. So again, kind of basic, what we call basic science data outside of the person and in animals. So what about humans? Oh, one more group of studies that actually is very interesting. In many different animals, they've given them influenza, which is the virus that causes the flu. And they've noticed increased mortality when giving these animals medications that bring down the fever. So what about humans? This is a fascinating study. I don't know how they got people to sign up for this, but they took a bunch of adult volunteers and they stuck rhinovirus up their nose. And rhinovirus gives you a cold. So again, I don't know what they did for these people. They must have paid them a lot. But they had a bunch of volunteers. They infected them with rhinovirus, and then they randomized them. So they took some of them and they gave them placebo, which is fake medicine. And they gave some of them various different types of medicines called antipyretics that bring down the fever. And they found that when they took their blood and looked at their antibody levels, that the people that got fever medicines had made fewer antibodies. That's what they found. And that they tended to have increased cold symptoms. So things like the runny nose and the congestion tended to be worse in the people that got medicine for their fever. And there was what's called a trend towards prolonged symptoms, meaning they didn't have really enough people to make that conclusion, but they saw that it seemed like more people had a longer period of time that they were sick. What they didn't talk about in this paper was how many of them felt so much better because the fever had come down, they were able to go back to work. They didn't mention that. But it did seem that in this particular study that people that got medicines for their fever seemed to have a little bit more symptoms from their colds and didn't make as many antibodies from them. Now, nobody dies from a cold, so they all recovered eventually, which is good. I didn't want anybody to worry about that. So pediatric vaccines, this is very interesting. So this is a recent discovery that has really changed one of the things that we used to routinely do. So it used to be maybe 10 years ago that when a kid came in for vaccines, we told the parent, give your child some acetaminophen, which is Tylenol, before they get their shots to prevent them from getting a fever. This was pretty routinely done in most doctors' offices all over. And this large study in 2009 showed that when they randomized kids to either get the Tylenol before they got their shots or not, that those that got Tylenol had less of a response to the shots. And shots are supposed to stimulate your immune system and you make antibodies, and that's what protected you. What they didn't show was whether this was actually significant. Did it really impair their ability to then respond to, say, polio or measles or whatever? They didn't show that, but they did show that it had an effect on their ability to respond to the shots and to actually produce the antibodies that we're trying to get them to make. So we no longer do this. We no longer routinely give anti-fever medicine before a kid gets their shots. So it's changed management. The bottom line seems to be that that we have evidence that for all of the different kinds of organisms that stimulate the immune system and can cause a fever, that there seems to be some bits and pieces of evidence that suggest that the fever itself is somehow helpful in responding to that organism. I want to acknowledge, and this is actually a very important point, that the quality of this evidence is not great. I mean, animal models don't mean that things are the same in people. There's not a lot of, good, large, randomized controlled trials of otherwise healthy people with viruses like influenza that we care about, except in experimental models. So I think the point that you might be making, which is to take this evidence with a little bit of a skeptical eye, I think is a very important one. But can we make conclusions that all fevers are beneficial, or that all fevers, if you treat them, are going to cause a person harm? Absolutely not, from this evidence. So another really interesting piece of evidence that's come out recently and also has changed the way we manage patients is in patients that are critically ill, so patients that are in the intensive care unit, for various reasons. And people have started to look very critically, again, at a routine practice, which is in these very critically ill patients, we worry about them getting elevated heart rates and getting uncomfortable from fevers and potentially having brain issues already, so that an elevated body temperature could be dangerous to them, even though it wouldn't be dangerous in a normal person. And so it's usually been routine to very aggressively treat and bring down fever in these critically ill patients. And recently, several studies have shown that in those patients, if they do have an infection, that those that are allowed to remain febrile tend to do better than those that are routinely treated for their fevers. Again, this is not a normal healthy kid or even a normal healthy adult. These are very critically ill people with abnormalities in their ability to respond to infection and who have other medical problems. But again, it really does challenge, I think, our typical thinking about it's important to keep the body temperature normal, and it suggests that there may be a function that could be quite important to having a fever. So what do we draw from all of this? And we've talked about it a little bit, but hopefully you're as confused as I am, that there's a lot of indirect evidence. There's nothing that really answers, I think, the core question, which is, what about my kid who has a fever and who's miserable? Am I going to hurt them if I treat their fever? So I think there's a couple of conclusions that we can draw from this. One is that increased body temperature does seem to have something to do with the rate of bacterial growth, not viruses or parasites, but it does seem to have something to do with the rate of bacterial growth, and it does seem to have some function in the immune system. I think that's fair. We can say that. We can also say that in critically ill patients, fever may be quite important in fighting off serious infection. In other words, if your other defenses are down and it's already very difficult for you to fight off infection, fever may in those situations be quite helpful. What it doesn't tell us is the relative importance of fever in otherwise healthy people with otherwise routine types of infections, like the viruses and even things like ear infections and throat infections that normal healthy kids get. And I think that's where we have to weigh the potential for marginal benefit versus possible harms. And I'll put that together in the next few slides and a little bit of practical advice for you. So practical advice, here's a very hot child. So do not fry an egg on your febrile child's forehead is the first piece of advice I have for you. So we're going to address the following questions. What should I do for my child when they have a fever? When should a child with a fever actually be brought in to see a physician or a nurse practitioner? And when does my child need antibiotics? So we're going to put everything together. So this is, in preparing for this talk, I looked at the internet for a lot of parental advice on what to do about fever. And there is an enormous amount of it out there. And I just picked this one out because I really liked the title of her blog, which is called Journey to Crunchville, One Mom's Journey into Becoming a Crunchy Mom. And I have to say, this blog actually had a lot of great info. So not to be critical of this actual person, her blog actually had a lot of very, very practical advice and interesting stuff. But she took on the great debate of fever. And in her discussion about fever, she made the following statement. She said, when we reduce a fever, we are eliminating our body's natural defense mechanisms, and we make it harder on our immune system to fight off the infection. It can actually make the illness last much longer than it would have. I'm not sure we can really say that that's true. We can certainly say that there seem to be some benefits, but I don't think we can say for sure that we're making it harder for the immune system to fight off the infection, or that we're necessarily going to make an illness last longer. And we have to also consider the fact that a person is going to feel better when their fever comes down. But these are the kinds of statements that you see that are various interpretations of the evidence that's out there that, in my opinion, is not particularly strong and has yet to make this conclusion completely. But these kinds of things are found on parenting websites and are commonly recommended to parents, that you're going to harm your child if you treat their fever. You're going to impair their ability to fight off infection. these are the things I recommend, that when a child has a temperature, I recommend that you take their temperature. And take it by the best method you possibly can. If it's a young infant, the rectal temperature is very helpful, again, because we're very concerned about small changes in temperature. For an older child, taking it however they're comfortable doing it, oral temperature with one of those little strips with the ear thing. But take the temperature and get a sense of how high it is. It doesn't have to be an exact number, but get a sense of how high it is. And that information can be helpful to us as providers in helping to think about what might be going on for your child. And the second thing that's really important is to observe your child's behavior. So you want to really pay attention to everything they're doing. Are they looking at you? Are they breathing normally? Are they able to take fluids? Are they sleeping okay? These are all things that can tell you how sick they are and also how they're responding to the fever. And strangely enough, the height of fever doesn't necessarily correlate with how uncomfortable a child is. So I've seen kids in the clinic with a fever of 104 that are running up and down the hallways and couldn't care less about the fact that they have a fever. And I've seen kids with a 102 that just look awful. And I'm about to do a lumbar puncture on that kid for meningitis because they look that bad. So the actual temperature is less important than how the child appears. Should you treat the fever? Okay, and this is really kind of the core of this talk, right? The bottom line is, don't panic. The fever itself is not going to harm your child. I think we've established that. There is, however, no good evidence, again, that in otherwise healthy kids with routine childhood illnesses, that treating their fever is going to hurt them. So I don't want people to leave this talk feeling like if my kid is miserable and I think they're going to feel better if I treat their fever, that I'm going to hurt them by doing so. You are not going to hurt them by treating their fever if it needs to be treated. But the question is, in which kids are they going to benefit from the treatment? And I would say that's in kids who have something over a low-grade temperature, so a temperature that's over 100.5. If the child is uncomfortable, can't sleep, or is unable to take fluids, then I would consider treating the fever. And I was doing a talk at a conference recently, and a gentleman stood up afterwards and said, I never treat fever in my own kids because when they have a fever, that's the only time they stop running around and they'll actually stay in bed. So, a good point, but there's the child that's staying in bed and there's the kid that's so miserable that they can't sleep, they have chills, they won't take anything to drink. That's definitely not good for them either. So this is where your judgment takes over as a parent. If your child is miserable, bringing down their fever will help them. It will make them feel better, and they may be able to do some things that actually in the long run are able to benefit them and help them get healthy more quickly. If you do decide to treat a fever, there's no question that the oral antipyretics are the safest and most effective way of treating a fever. We strongly recommend against using ice water or alcohol because those can actually cause hypothermia in children. However, there are some nice studies that show that while if you compare, say, Tylenol and Motrin to cool sponging, the Tylenol Motrin definitely works better. But if you combine the two, that works better than either one alone. So in that period of time when the set point has gone down and the child is trying to cool themselves off, that's a good time to have them do a cool bath and to fan them and do all of those things because it'll help their temperature come down and it's going to feel good to them, as opposed to doing it when the fever is coming up, when the last thing they want is to be cold and undressed. All right, so when should a child with a fever see a doctor? So putting my pediatrician hat on, I want you to bring your kid in when I think there might be an infection that we need to treat and do something about, and that varies based on age. So anytime a child with a fever appears ill, and the word ill is a medical term in this case, which means listless, not responding, breathing funny, things like that. So a kid that looks not well with a fever, and even though you treat the fever, they continue to look unwell. Even if the fever comes down, you should bring that kid in. It's commonly stated, and I often have parents ask me, I got really worried because I gave medicine, the fever didn't come down. Doesn't that mean it's worse? There's actually no correlation whatsoever between the severity of the illness and whether or not a fever responds to fever medicine. So if the fever responds but the child still looks ill, I'm worried about that kid. If the fever doesn't come down to normal but the kid feels better, super, you're good to go. So that's far more important than actually whether the temperature is altered in response to the medication. I do recommend calling your doctor, nurse practitioner, or provider if your child is less than 1 month of age with any sort of temperature at all, and that's greater than 100.4 for young kids. 1 to 3 months of age, we let them get a little bit higher. We say 101.3 for those kids. So if they have a fever higher than that, then I would definitely call them. And after 3 months of age, we let kids have a fever for a couple of days before we get too excited about it. And again, this is assuming that they look okay and they're able to take fluids. If a parent calls me and they say, my 16-month-old has a fever and it's, 103, I say, how does your kid look? And I talk to them about how the kid feels. I recommend them doing things that are going to help their child be more comfortable, which may include bringing down the fever in some cases. And I say if the fever goes on for more than 2 or 3 days, then I want you to bring your kid in, and here's what to look for in the meantime. All right, so what will we do if a child does come in with a fever? And again, this happens all the time. This is one of the most common reasons that people bring kids in to the clinic. So we'll basically look for evidence of either a bacterial or viral infection, or more importantly, an infection that we can treat and that we want to do something about. And so this is going to include a very thorough exam, looking in the ears, looking in the throat. In the very youngest infants, we know that even ones that look very well, when they have a fever, they can have a serious infection. And so very young infants less than a month of age, often we will do blood tests, urine tests, or even a spinal tap, even in a kid that looks pretty well, to make sure they don't have a serious infection. The fevers, thankfully, are rare in that age group, but when they do have a fever, we take it extremely seriously. And we may, in many cases, because the way the child looks and our ability to assess them is such an important part of telling whether they're critically ill, that we may give the child fever medicine to make them feel better so that we can be sure they don't have meningitis or a more serious infection. So that's commonly something that we'll do in the clinic. When do children need antibiotics? So I think this crowd certainly knows that not everybody with a fever needs antibiotics. So when do they need antibiotics? Most kids with fever, it's caused by a virus. Viruses go away. There's no effective treatment for them. You really just need to keep them comfortable. Good old chicken soup and some fluids, that should do it. Common bacterial infections in kids that we do treat with antibiotics are going to vary by age. So in very young infants, actually the most common bacterial infection is a urine infection. In kids a couple of months of age, we commonly actually will find a urine infection in those babies if we check their urine. As they get older, ear infections become very common, then pneumonia, and then things like strep throat. So bacterial infections in general become less common as kids get older, but they're also going to change. The ones we're concerned about are going to change as children get older. Thank you. That's all I have.